Well, let's return now to the doctor strikes and the government's proposal for a minimum service level in the health service. I'm joined in the studio by the Health Secretary Steve Barclay. Good to see you this
Good
morning.
morning.
Thanks for coming in. So both consultants striking today, tomorrow both consultants and junior doctors striking today. The first time in the history of the NHS that this has happened. How have you let it get to this? This is happening on your watch.
Well, we've accepted in full the recommendations of the Independent Pay Review Body. That means a junior doctor starting in the wards this summer will be getting a pay rise of up to 10.3%. The average for junior doctors is 8.8%, which is, I suspect, more than many of your viewers themselves are receiving. We also responded to the BMA's number one ask, which was for very significant changes to pension taxation, which the government has agreed to, which is an extremely generous uplift. But we also need to be fair to other workers across the public sector in terms of how we bring inflation down and manage the costs of that, whether that's in our armed forces, our teachers, elsewhere within the NHS. And we also need to be focused in terms of bringing inflation down as well. So we've got to get the balance right. That's why we've accepted the recommendations in full. But the demand for 35%, which is what the junior doctors are asking for, I don't think is reasonable and would not be consistent with bringing that inflation target down.
You're launching a consultation today to try to enforce minimum service levels for hospitals. Why are you expanding anti-strike legislation instead of getting to the root of the problem? Wouldn't it be quicker to get around the table and talk about this? Because my understanding is this could take up to 6 months to bring in.
Well, as I say, I don't think meeting a 35% demand is reasonable. Well, what we're announcing today is how we protect time-critical hospital services. So things like chemotherapy, things like dialysis, because we recognise the right to strike is important, but we've got to balance that with also the right of patients to key treatments like chemotherapy, like dialysis. And this is something that other countries have a balance on. If one looks at France, if one looks at Italy, in terms of providing a Sunday service when they're all strikes. So it's proportionate to look at what other countries are doing, to have legislation that protects key time-critical treatments like chemotherapy, whilst also recognising whether it's on things like outpatients or hip or knee operations, then those are disrupted by strikes. But I think that's different to time-critical urgent and emergency care. And what we've seen in the strikes to date is even where exemptions are agreed locally between NHS leaders and BMA representatives, the National Committee in August refused 17 exemptions that had been agreed locally as proportionate and necessary. The National Committee refused, and that's why it's important we have some safeguards in place in the way that other countries do.
But we have safeguards in the sense that the BMA have said that there will be a Christmas Day service. You were talking about a Sunday service. So there is going to be a level of service. They're saying that there is no concern that should somebody come in after a car accident or something, that they wouldn't be treated, that they are providing a safe level of service. Why do you need to bring in extra legislation?
Because I don't think a Christmas Day service gets the balance right. There's a difference between, you're right, there's life-threatening treatment that is covered through a Christmas Day service, but that doesn't cover things like chemotherapy. It doesn't cover important treatments like dialysis or induction of labour. So there's things that are missed by that, and we think it doesn't get the balance right. So it's about recognising what is time critical, what do patients need in terms of that safety net, how do we get that balance against also recognising that the right to strike is an important right for people to have. And that's why we think it is proportionate, having looked at what other countries do, to have the balance in terms of time critical treatments, to have that in legislation. It still enables people to exercise their right to strike, but it also protects things that would not be protected by a Christmas Day service. And we've seen this escalation, increasing militancy, a desire politically to time strikes, including with the Conservative Party conference, to refuse exemptions that have been agreed locally by their own representatives, as we saw in 17 cases in August. And also it's very difficult for the NHS leaders to plan if they don't know until the last minute what exemptions are going to be in place or not. So having more certainty for patients, having more clarity for managers, getting that balance right, looking at what best practice is in other countries, that's a proportionate response, but above all, it's focused on patients. How do we protect those time-critical services when people are on strike?
Can we talk about the timescale for this legislation? There are reports that it could take up to 6 months. Is that true? I mean, is that your realistic timescale for bringing it in?
Well, we haven't set a timescale. We've got the primary legislation now in place across 6 sectors, so that is already passed.
So that happened in July?
That happened in July.
Why didn't you include the doctors in that in July. Was that an error?
Well, no, that's the sort of enabling framework across a number of sectors, including transport, not just health, so across a range of sectors. Within health, we want to get the balance right. Now, we've seen this escalation. That's why we've been concerned in terms of hospital services. We're seeing things like chemotherapy, dialysis impacted by the strikes. We're seeing exemptions refused, as was the case in August. So that's why we're consulting on this. We've got the enabling legislation in place. We then want to get the detail across the UK, right, because this affects employment rights, affects Scotland and Wales as well, but health is devolved in those countries, and that's why we've got to get that balance right.
We spoke to you last week. We talked about concrete cancer in buildings. We also talked about extra funding that the Prime Minister announced for this winter. It's been reported in the Health Service Journal that this £200 million that you and Rishi Sunak announced last week is going to be held back to cover the costs of industrial action. So if this potentially is going to take months to resolve with the minimum service level legislation that you're bringing in, how on earth is the NHS going to cope this winter if we've got another 6 months of strikes and the money that you've set aside to help deal with this crisis is going to be spent covering the strikes and not actually on patient care?
Well, there's a number of things there. I think, firstly, one of the things health leaders have said to me in respect to past years is often money for winter is announced very late, often in November. That's traditionally when additional funding has been announced. So one of the first things they asked for was earlier clarity, earlier money. This is new money, this is additional, an extra 200 million we're investing. But of course it comes on top of significant investment, particularly in our community diagnostic programme. We're expanding, we've got 190 new community diagnostic centres. Many of your viewers will have a community diagnostic centre near to them. We've got 119 of those open. We're expanding our surgical hubs to have more resilience. One of the things, again, that often happens is as there's winter pressures, elective operations are cancelled because there's more people going into hospital. By having what's known cot and hold sites, separate sites for surgical treatment, those hubs allow us to actually get more people through during the winter period. We're expanding those. We're also investing more in technology. I think we're all seeing huge developments in things like AI that has significant opportunities in terms of our investment in health. We've got 2.1 billion going into tech investment across the NHS. And you touched on the hospital estate, and I think that is important as well. When I talk to hospital staff, the hospital estate is a key issue, and the government's got the biggest ever investment in the NHS estate. Over £20 billion. We're investing £4 billion a year specifically into hospital buildings and estate. So we're investing both in the technology, in the estate, but above all, boosting our capacity. But one of the key messages NHS leaders said to me was they wanted earlier clarity on that funding, and that's why we were so keen to announce that money earlier than would normally be the case.
Pity it'll be going to the strikers, though, rather than the actual NHS. Can I ask you about a question about Russell Brand? And obviously, there have been a lot of allegations made about him, which he denies all of them. But from these allegations, there's a conversation that's arisen about an alleged relationship between him, a man at the time in his 30s, allegedly having a relationship with a 16-year-old girl. She's now a woman, has children of her own, and she says she thinks that there should be a conversation in this country about the age of consent. Do you think that we should be having a conversation, that we should be looking at whether it's appropriate in terms of the age of consent to look at perhaps the age differences in relationships? In some countries, for example, there's an age of consent of 16, but that's only if you're having a relationship with somebody a couple of years older than you. You're not allowed at 16 to have a relationship with somebody a lot older than you. Do you think that's something that we should or could explore in the UK?
I think there's many issues coming out of the allegations that I think need serious scrutiny. I think, firstly, it's extremely brave of the way that people have come forward, and it's important that those are investigated. And the Met Police has said if anyone's got allegations, it's important that they come forward to the Met Police so that they can investigate. It's important that employers look at what happened in terms of their duty of care to their staff and are very transparent in terms of what's happened there. And it's important that we look more widely at some of the behaviours and what lessons there are. So I think there's a lot that's come out of recent days. It's extremely serious. It's very concerning to hear the stories from the women that are coming forward. And in particular, it's important that people come forward to the Met Police where there are allegations so those can be fully investigated.
But no interest in raising discussions around the age of consent?
Well, I think let's look at the issues as they arise. I think the first issue is in terms of any criminal action where there's allegations that needs to be investigated, and the Met Police have said, anyone with concerns should come forward to the police so those can be fully investigated.
Final quick question. Sky News exclusive report we have this morning about crypto gambling, which I have to confess I didn't know a great deal about before this morning. Illegal in the UK, but gamblers are still accessing. Is the Department of Health worried about the rise of online crypto gambling? Because, of course, there can be enormous mental health implications from gambling addiction, can't there?
We are, and I think Sky's to be commended. I think it's an extremely important investigation that you've led. The fact that we've opened 7 additional gambling addiction centres this summer, I think points to the wider challenge that we have as a country in terms of gambling addiction. The government has a white paper looking at how we better regulate some of the websites that facilitate this behaviour, and I think there's much that's come out of the investigation that I know colleagues will be looking at.
Steve Barclay, thank you very much for coming in. Thank you. Right, let's get a look at the weather now.